I thought I talk about the use of psychiatric medications today. So, few salient pointers, tips can be provided. When you're considering the use of a psychotropic medication or psychiatric medication, I'm just going to sit down over here. If you're considering the use of a psychiatric medication, you need to be clear about what it is that you're treating. So, is it a depressive disorder? Is it an anxiety disorder? Is it something that is bordering on psychosis? These are things that you need to have a ballpark idea about. In fact, the diagnostic system in DSM-5 has artificially gotten very specific, and there are precise diagnoses with DSM, ICD codes. Yes, so be clear about your diagnosis. And then after you have a sense of what kind of an illness it is, figure out if there's any medical reason for them to have these symptoms. Could a medical cause, could a medical illness, could medications or a drug interaction be causing the symptoms that your patient is having? So that's a whole field in itself, and that's what psychiatry is all about. You're trained as a medical doctor, and so you're able to recognize medical conditions and then furthermore collate them with psychiatric symptoms. There are several, in fact there are many conditions that can have psychiatric symptoms as a feature. A lot of the cancers can first manifest as a depressive or dysthymic state. Dysthymia is basically chronic low-grade depression. And then you have the endocrine disorders. Hypothyroidism is a big one. It can cause, if it's low, it can cause problems with depression, metabolism, and other things. If it's high, again, the person can be high-strung, anxious, thin, perspiring. It can very much look like a anxiety state. If they have tumors in the brain, that can certainly cause cognitive problems, mood problems, and reality testing problems at times. The endocrine disorders are a huge area where medical illness and psychiatric symptoms interplay with each other. A lot of the autoimmune diseases cause psychiatric symptoms. Some of the chronic infections, such as hepatitis C and B, and the treatments that are given, the antiviral treatments, plenty of them have psychiatric repercussions, psychiatric side effects. In fact, before a patient is provided treatment for hepatitis C, we screen them for depression, and then screen them during treatment for depression, because the rate of the incidence of psychiatric side effects and depression is rather high. So once you have their psychiatric diagnosis clarified, look at their medications. A lot of the glucocorticoids, like that's corticosteroids, can have effect on the mood. Some beta blockers, they said, can cause a depressive state, although there's some back and forth about it. There can be interactions between the different medication the patient is already on. So look at all of that. So once you decided that, well, this person does have a condition that could possibly benefit, then we can look at the different medications and how these should be prescribed. Also look, of course, at the psychosocial stressors. they are a big factor. In fact, in the old days, like when I went to medical school, they had something called endogenous depression and exogenous or depression. Endogenous was the one that was supposed to benefit from somatic therapies like medications, ECTs, things like that. And exogenous was due to external stressors, and it was almost taken for granted that you would address exogenous depression with therapy, and medication was a secondary option. And nowadays, medications have been pushed forward to the forefront so that we're giving antidepressants and anti-anxiety medications to depressions induced by psychosocial stressors. And in a way, that's probably appropriate. There's nothing wrong with it. But it just underlines the point about medications having been pushed to some extent as the main treatment modality. The fact is that psychosocial interventions have just as much a role in alleviating psychiatric symptoms, especially related to depression and anxiety, and as much as medications perhaps do. So, so you identify, you make clear what the diagnosis is, and you see if they fit a depression or anxiety disorder diagnosis or a psychotic disorder diagnosis. Then you look at their past history. Have they been treated with these medications? Has something worked in the past? Does a family member have a similar condition? And if so, have they been treated with medications? And what medication were they on? So then that might give you a clue about what kind of medication to prescribe. So you get a sense of their physical health, their vital signs, and then you can prescribe the medication. It's always a good policy to go slow and start low and go slow, unless it's an urgent, emergent kind of situation, when there are protocols that the seasoned psychiatrist can use. So once you decide on a medication, get it to an effective therapeutic dose and give it for an adequate duration, so that there's no qualms, that you don't have to look back and see, maybe if I had given him another 50 milligrams of venlafaxine or Zoloft, that maybe he would have turned around. Give an adequate trial, monitor for side effects, and educate the patient. Let them know what side effects to expect, what are serious, what are like benign, so-called benign, that are not dangerous to the patient, like a little bit of dry mouth or some feelings of sedation. If the patient is educated about that, they'll be less tense, less anxious about these things. And you don't want to increase anxiety or distress through medications which are meant to help them feel better. So monitor them with the atypical antipsychotics. If you use them, you have to monitor their cholesterol, their lipid profile, their weight. With antidepressants, they're pretty easy to use. With venlafaxine, you have to monitor their blood pressure. You have to be wary about too much SSRI dosage, because people tend to increase doses a bit too fast, and the doses just keep accumulating. A lot of times a prescriber is hesitant to remove anything, so things keep getting added on. So be careful about giving too much of something. And then identify target symptoms that you want to measure. You want to gauge the effectiveness of the medication by identifying target symptoms and measuring them. Ask the patient to rate them from a 1 to 10 and document that so that you have a measure. There are, of course, the rating scale that you can use as well, but a lot of times it's just simpler to ask the patient to rate the symptoms that were identified in the beginning. So anyway, those are some guidelines for prescribing medications. I hope you're doing well, staying safe, and I'll see you in the next video. Okay, take care, bye.